everybody, and welcome to another Stay Connected segment with Mike Hirsch, the Medical Director for the Division of Public Health in the City of Worcester. And you caught me on a really big high for me and my family because my daughter got married a few days ago. And you might ask, well, how did you do that in the middle of this Delta surge? Well, my daughter and her fiance are both residents after completing medical school here at UMass. They're living out in Pittsburgh, but the wedding was here in Massachusetts. So they wanted to be super extra careful that their wedding was not going to be a super spreader event. So what they did was kind of life now in the COVID era, right? They made everybody that attended the wedding show proof of vaccination, and they made everybody who went to the wedding test right before coming for the COVID. So it could have been a PCR test or a rapid antigen test. And we also didn't have any children there except for one flower girl, and she got tested multiple times because we didn't want to make any possibility of a super spreader event happen to all these people that we loved. And the wedding came off without a hitch, but it really got us thinking about like how life has changed. It makes everything much more complicated, and I totally get where people are just so tired of these complications, tired of all of these extra steps you have to take to go out, to go somewhere, to go shopping, even sometimes even just to take a walk. Right now in the city of Worcester, I'm not the most popular person because what happened over the last month is as we saw the schools reopening, Labor Day gatherings, colleges coming back, we knew there was going to be a surge in the middle of September. So I spoke to the city manager, I spoke to the mayor, I spoke to the superintendent of schools, and we all agreed that we should be ahead of the curve. So we passed an emergency order of a mask mandate within the school system. That's courtesy of really the school committee led by Mayor Petty. And we passed one now, an emergency order for the indoor use of masks, wherever you go in a public space indoors. Now, if you have a private office, you're going to be able to sit there in your office with your mask off. But in the common areas, like going through an aisle of cubicles or going on an elevator, going through the lobby, you have to wear your mask. And in retail establishments, you're going to have to wear your mask indoors, and we're asking all of those retail establishments to put signs up to tell people, please wear a mask. We're also telling the community in general, be friendly to masks. Masks are our friends, and I'll talk a little bit more about masks in a second. So these emergency orders went into place about 2 weeks ago, and yesterday the Board of Health here in Worcester was kind enough to ratify them. So it's not just me as the director of the Department of Public Health, but it's also ratified by the group of really wonderful people who volunteer their time to sit on our Board of Health. And they passed it unanimously. So it was kind of an interesting meeting that we had during the Board of Health meeting yesterday because it was very clear that people aren't crazy about masks. And the only people that called in for public comment about the meeting were all very, very against masks, and they weren't very happy with me. And it pains me to get that kind of criticism because I have no agenda other than to try to do the maximum good for the maximum number, keeping the public safe. We know how transmissible the Delta virus is. And in the unvaccinated population of Worcester, and that's still roughly about 30% of the community, you are 10 times as likely unvaccinated to end up in the hospital if you get COVID, and 11 times more likely to die. This is a very, very important thing. What we're seeing now, and you probably have heard how our hospitals are bulging out at the seams, that there's no beds, people are waiting long time in the emergency departments because there's just no room for COVID patients, plus patients that are coming in with what they normally come into the emergency room with: chest pain and loss of vision like before a stroke, or appendicitis, or diverticulitis, or all these fairly routine emergencies. We're choking the system because the hospital's full with COVID patients. And out of those patients, 80% of them are unvaccinated. 80% is actually a lower number than other hospitals. And the reason is that UMass has such a wide community of cancer patients, of transplant patients, of patients with immune disease. Those patients are much more vulnerable to the COVID infection, even if they are vaccinated. And that's why our number of unvaccinated percentage is a little lower. Because in most other hospitals, 90% of the people that are getting admitted are unvaccinated. And that's why you've heard Dr. Walensky from the CDC, President Biden, Dr. Fauci, all said this is an epidemic right now of the unvaccinated. And the unvaccinated people are the ones that are allowing this virus to continue to propagate. And when it propagates, eventually a mutation might form that can escape the vaccine's capability of fighting it off. That's what we want to avoid. So we've been trying our best to get needles in arms. And what we have found, truthfully, is that people are so tired of us talking, and people are so tired of the thought of getting this shot when they've fought it off all this time. They've had since January to get it. They still don't have it. They thought they could just avoid it. Maybe they got COVID and think that their own immunity from having had COVID is better than the vaccination. I'll come back to that. That's not true. They decided not to get it. So we stopped doing all the begging, and we stopped doing, we're still doing a lot of knocking on doors and setting up vaccination clinics for the folks that are hesitant. Maybe they're deciding now to get the vaccination. But I think more and more what you're going to see is, whether it's individual companies or retail outlets, or as we have done for the city government, we're mandating vaccinations. Mandating vaccinations in the city government by November 1st, which gives us about 6 weeks to get everybody their 2 shots, plus 2 weeks after the second shot to make them maximally immune. And it's not the step we wanted to take. We thought people would just be lining up like everybody was in January. Everybody was trying so hard to get the vaccination in January. We just couldn't keep up. We didn't have the supply, and we didn't have the locations to give out the vaccine fast enough. But something happened. I think it was an absolute deliberate campaign to spread misinformation about the vaccination. This is not a plot. There's nothing in the vaccination that's going to tag you so the government can follow you around. There's nothing in the vaccination that is dangerous to your body, because how do we know this? This is not something that was just cooked up in the 9 months since we first started the pandemic till the time that the vaccine was released. It was actually worked on for decades. It started being worked on in the 90s. It just was true that we finally got a virus like COVID-19 that was perfectly made for us to attack with a vaccination program. So remember, we've talked about this in the past. COVID-19 has on its surface these little spike proteins. You've seen the pictures, the big, blue ball with the red spikes on it. That's how almost all of the COVID images look. Well, that spike protein on the surface is the one that the vaccinations attack. And what we do with the vaccine is we actually take a piece of mRNA, which is the chemical messenger that teaches the body how to make the spike protein, and we inject that into your muscle. And once it's in there, the spike protein is made, and your body starts to react to it by creating antibodies. And those antibodies are going to keep you from not necessarily getting the COVID virus, although 90% of the time you won't get it. But if you get it, you will not end up in the hospital and you will not end up in the ICU. That's key. So you hear a lot of people talking about, why should I get the vaccination? There's so many people who got the vaccination, they're still getting COVID. They're still getting COVID because the unvaccinated people are spreading it. They're likely building up such a viral load in their bodies, these unvaccinated folk, that it sheds out. And if you get enough of a viral load, even the vaccination can't fight it off completely. So most of the people that get these breakthrough infections, they don't even know they're sick. They may get notified by our Department of Public Health. Oh, you've been a close contact to an unvaccinated person that had COVID. Please get yourself tested. They test and they test positive and they're like amazed. Wow, I didn't even know. That's the virus not being able to overwhelm the system of the vaccinated person. The vaccine is working. It's not that it's not working, it's working. And it's working to keep us safe. The more people we can get vaccinated is the best way for us to get out of this terrible period where all we talk about in health is COVID. We don't want to talk about it anymore. We don't want to deal with it anymore. But we can't be ostriches. We can't put our head in the sand and say, if I don't do anything, everything will go away. It's not going to be like that. So there are still plenty of opportunities for us to get into a super spreader situation. That is why we instituted these mask mandates for indoors, because that's what the virus loves to do, is be indoors, have one person sneeze, or one person cough, or one person sing, and the next thing you know, they're showering everybody with these droplets that will contain the virus. And whether you're vaccinated or not, you're going to be exposed. Vaccinated people are generally not going to get this virus easily, but unvaccinated people might. And what we have learned since the Provincetown outbreak is that if you have a breakthrough infection as a vaccinated person, you can shed the virus. That's the reason why vaccinated people have to mask up too. That's a question we get asked all the time. I got vaccinated. I don't feel like I should have to wear a mask anymore. What's the advantage anymore for getting vaccinated if I still have to wear a mask? The advantage is you're not going to die. You're not going to go to the hospital. Only 6% of the people who have breakthrough infections end up going to the hospital. And the greatest majority of them are very elderly or have other conditions, particularly immune problems like HIV, or people that are on cancer medications, people that are on steroids. These are the people that can't fight the virus off even when they've been vaccinated, as well as other people. So I feel very strongly that the Department of Public Health here in Worcester and the Department of Health and Human Services, led by Dr. Castile, are trying to look out for all of us. We're not in the business of making people miserable. When people call in and say, you know, you're tearing my family apart, my child in school hates wearing a mask, I might have to pull my child out of school, I'm really, really sad, because that wasn't our intent. But I have been a pediatric surgeon for over 35 years. I know what kids can do and what they can't do. They are incredibly resilient. I have operated on them and created all different kinds of recovery issues for them, and they adapt. But they have to have parents and grandparents that understand that the adaptation needs a cheerleading section. And if you, as the parent, are saying to the kid that masks are terrible, they will say, yep, masks are terrible, my mommy and daddy told me so. If you say, on the other hand, masks can save your friends from getting sick, they're going to wear their masks. It's all in how you present it to a child. So I think that a lot of our problems are self-made. We have to show adaptability, and we have to show the willingness to continue to fight this. I said this a few weeks ago at a press conference. I was really touched by all the commemorations for 9/11. You know, 20 years. We've been in a different world. Life changed in one blink of an eye on 9/11. Almost 3,000 people were killed that day. And it's left a lasting scar on everyone. The day that we had our press conference to talk about the new mask restrictions, 3,500 people died that day of COVID. That's more than 9/11. And it was happening every day. 3,000 or more people were dying in that 2-week period. The numbers since then have come down a little bit. And that's encouraging. And I think the numbers in Massachusetts may be on the verge of plateauing and starting to come down. But now is not the time to give up the fight. There's going to be so many activities coming up now in the next several weeks. We've got Columbus Day, we've got Halloween, we've got lots of activities regarding fall sports as the school sports scene gets busy. If we are good about wearing our masks, if we are sensible about continuing to wash our hands well or use hand sanitizer, if we can relatively keep some distance, I think it's going to be a much safer place. And perhaps this winter, unlike last winter when all of the big Thanksgiving and Christmas celebrations came on, we won't see that huge surge in December and January, and the virus may peter out. So where are we at right now in Worcester? 58% of the population is fully vaccinated. That's 58% of the eligible population. Who are not eligible? Children less than 11. That's about 10% of our population. 10%, if you add it to the 58, would get us up to just about 70%. So what about the remaining 30%? Those are the people that are hesitant, that are resistant, and then some that are just frankly campaigning against vaccination for lots of different reasons. Some don't believe in vaccinations, period. Some have made this a real political issue. And those are the people that are getting sick and going into the hospital, and they're unfortunately the people that are holding us back from getting that herd immunity number. What is that number? Probably 80%. Now this week, the FDA is looking through the data from Pfizer about their 5 to 11-year-old vaccination proposal. And I think it's going to pass. I think Moderna and Johnson & Johnson are also going to pass, but it's going to be a few more weeks before the FDA rules on it. When that segment of the population has the opportunity to get vaccinated, we can really cut down on the spread in the schools. And there is spread going on in the schools. Unfortunately, in the age group between 12 and 18, who are in our middle and secondary schools, the vaccination rate is still only about 40%. That means 60% of the kids are not taking advantage of approved vaccination, not just emergency approval, real formal approval, because that happened for the Pfizer vaccine. It's going to happen for Moderna and J&J as well in probably a couple of weeks. All of these vaccine corporations have submitted data that's being very, very carefully vetted. We're not rushing the FDA, we're not rushing the CDC, because we don't want to be accused of trying to, push this through without proper vetting. And it's not going to be pushed through. They're taking their time, and they need to deliberate very, very purposefully to make sure we're all safe. If they have any questions, if you remember, last year, out of 15 million Johnson & Johnson injections, 6 people out of 15 million had a problem with a blood clot in the leg, and they shut down production of Johnson & Johnson for like 2 months. So the FDA and the CDC are our friends, and they are very careful and very meticulous. They are not going to let us down. But once all these approvals come, I hope that some of the people that haven't gotten the vaccination will stop the excuse that, oh, I don't want to get it because it's only an emergency approval. We're getting to the point where all of these 3 forms of vaccination will have real permanent approval, and those excuses should go away. I've also seen quite a bit of people that have said, well, if my employer mandates it, I'm going to get it. That's why these vaccine mandates have really pushed the needle so that we've gotten more vaccinations done in the last month than we had over the summer. Vaccine mandates seem to be a way of people just throwing up their hands and saying, well, if I have to get it, I'll get it. So if that's the way we have to do it, we'll do it. We've tried everything else. We've tried incentive programs, millionaire lotteries, grocery cards when you get your vaccinations, all different kind of incentives, and seems like the mandate works better. So, look, am I happy that we have to be heavy-handed, mandating masks, mandating vaccine? That's not what I expected. Like I said, I thought everybody would be just clamoring for it for a long time. And in those early days in January and February where people were calling us, I've been on hold for 20 minutes on the hotline, or I've been trying to get into the website, I can't get in. I thought that's how it was going to be. But once the supply got out there, it seemed like the interest went away. So now, the last section I'm going to talk about here is boosters. There's been a lot of controversy about boosters. But I think now what is clear is that there is a process by which your body loses some of its immunity over time from the shot that we give you. It's controversial about how long that period is. Some people say 6 months, some people say 8 months, but the FDA and the CDC have decided that they feel that the people that live in long-term care facilities and those that work there, that the first responders like police, fire, and EMS personnel, and home health aides and visiting nurses, those first responders, people over the age of 75, people over the age of 65 with coexisting conditions, people with immune disease or cancer, that all of those people should get a booster within the next few months. And is this a failure of the vaccine? No. You know, every year we give a flu shot because your immunity from the flu kind of goes away after a few months of time. And this will be something we have to monitor. Everybody is being studied now to see how frequently boosters will be needed. And if new variants start popping up, we may have to change the kind of booster that we give and tailor it to the new variant that comes up. But boosters are out there. They're going to start being distributed. You will find that we will have programs for those to get their booster shots in like more of a public health venue, but CVS and Walgreens and some of the pharmacies that exist inside the big shopping centers, they will be giving out these boosters. And we should all try to get them. When it's your time, try to get them. I got mine. I was given my first set of injections in the month of January. This is now towards the end of September. I got mine the beginning of September. So I think this is going to help us also tamp down the likelihood that Delta will continue into 2022. I think that if we are smart and we are compliant and we are patient, we will see that 2022 will be a new era here where the virus will not be a pandemic anymore. It'll be like an endemic, meaning it's going to be around. We're not wiping it out. It's not like polio, but we will have the tools to keep it on the down low, to not have these massive surges anymore. If we can keep the vaccinated people number rising, if we don't get enough of the unvaccinated to convert over to vaccinated, we could come up with a variant that could cause another surge. And that's why we still need your help. You are the elders in your families. And I know that you're probably vaccinated because 88% of the folks over the age of 65 in Worcester are vaccinated. That's a great number. But what it tells me is that you're probably dealing with children, grandchildren, who don't want to get vaccinated. And you might be able to engage them in a conversation where you would say, for me, please get vaccinated. You know why? Because if I get sick, even though I've been vaccinated, if I get a breakthrough infection, because I am one of the older folks, I am more likely than other vaccinated people to end up in the hospital. If I end up in the hospital, it's hard to predict what's going to happen. So maybe that's a way you can talk to your families. Maybe that's a way you can convince them. Get the vaccine for me. Get the vaccine for our family so we can have the gatherings that we want to have at Thanksgiving, at Christmas time. So we can go out and trick or treat feeling like we're safer. That's what we ended up doing for all of our wedding guests. I don't think that it was an easy thing for all of them to get tested, and some of them that we invited didn't even have their vaccination when we had the request that everyone had to be vaccinated to come, but they went through it for the rest of us that attended. That's how we have to look at it. We're not just doing this vaccine thing for ourselves. It's a gesture for public health. Pope Francis said that getting a vaccination was an act of love. And I believe that. I really do. And I think that Worcester has done a lot to demonstrate love during this last 20 months. We've supported small businesses. We've supported artists. We've supported the homeless. We've supported people who would ordinarily have been evicted to keep them from having to be tossed out into the cold in the middle of a pandemic. We've come up with all different kind of of monetary support for different organizations that were just helping refugees and immigrants. We have 350 Afghan immigrants coming here from Kabul now to live in our area with the kind of rescue money that the federal government has put forth because of the pandemic. This is a community that is very, very community spirited and wants the greatest good for the greatest number. So let's not let COVID push us apart. After 9/11, we had a sense of unity that something terrible had happened to all of us, and we weren't going to take it lying down. We were going to gather together and say, we love this country and we love the fact that we can persevere, we can overcome, and we can do the same thing if we attack COVID with that same spirit of we can overcome. But all of the disinformation that's out there on websites and on Fox News and on other outlets that are just spreading lies. I watched a show a couple of weeks ago where somebody said they were going to put the vaccination in salad dressing. I mean, that is just unconscionable, the kind of misinformation that's being spread. And right now, the way social media is, there's no way of pulling that back. People read it on their computer or on their phone or other places, and they say, well, it's right here on the internet. It must be true. No. Look at where you're getting your information. The sources are very important. And I know that it's hard to always agree with me on this, but trust the CDC, trust the FDA, and trust the Department of Public Health. We are out there to tell you the truth. If I don't know something, I won't say it, or I'll say that I don't know. But I feel like I have been trying to be a straight shooter with you from the very beginning. And every month when we meet like this, I feel so lucky that I have an audience where I can tell you the truth, and the feedback that I've been getting is wonderful, and I thank you all for that. But I was trying to give you the straight truth today because it's a critical time. We can change the way our world is heading by getting the vaccination, wearing our masks indoors. There are a lot of other things that are down the pike that will happen if this doesn't dissipate. If we don't see the virus receding, then we're going to end up going into lockdowns and distancing regulations, and who knows, maybe closing indoor dining completely. We don't want that going into winter because, who wants to sit outside in a cold patio with a heater? I know it was kind of fun in some ways last winter trying to do some of that stuff, but let's face it, we'd rather be inside and cozy and know that we're not doing the wrong thing. So I'm going to quit here because I know you're probably sick and tired of thinking about this and talking about this, but I know with the support of the senior community here in Worcester, we can get the word out that wearing a mask and getting a vaccination is an act of love. Let's listen to Pope Francis. I feel like he's got a direct line upstairs, and I think we ought to listen to his advice. So anyway, I will see you again end of October. I appreciate your time today, and I look forward to talking to you anytime. Thanks a lot.